thanks for coming back to my channel, Receiving Consent, and today we've got a question from Paul Cummings, so thank you Paul, from Twitter. The question is, how do we know that a patient has read and understood the patient information sheet? So this is a really good question, and he's also noted that there's no validated tool as far as he's aware for this. So I'd agree, I've not come across any validated tools for this, but I have to say, I don't think that's necessarily a bad thing. I think it's one of those situations where it's actually quite good to have the person in front of you, and you're able to look at the context around where they're at the moment, what's going on in their lives, and also you're able to kind of pick up on any non-verbal cues that they might be giving you. So I might be proven wrong on this. In like 5 years time I might be looking back and someone's come up with some amazing tool, so we will see. But the question, so how do we know that a patient has read and understood the information sheet? So my top tip for this is avoid any questions that have a yes/no answer. Okay, so consider the following. Oh, hi, I hear that you are keen to go ahead with the study. That's absolutely brilliant. Can I just check, have you read the information sheet that we gave you? Oh, you have? Oh, that's brilliant. Did you have any questions? No? Oh, fab. Can I just check, did you understand that it's a randomised study, so you could be put in one of two groups? Yeah? Yeah. Oh, fantastic. And you're okay with the follow-up arrangements and stuff? Yeah? Oh, that's amazing. Okay, that's brilliant. Okay, so my argument would be with that particular scenario that you don't actually know as a professional whether or not they have read and understood the information sheet. I'm not saying that they haven't, they may well have done, but you do not have that assurance that they have. Okay, so consider the difference with that particular scenario and the next scenario, which is what I tend to use when I approach patients, and I'm sure there are lots of different ways that people might do this. I'm just giving you my example because it's what I tend to do. So, oh hi, oh that's great. I hear you're keen to go ahead with the study. That's absolutely brilliant. Part of my role as a research nurse is just to make sure that you've really understood what we're asking you to do. So just in your own words, would you mind just giving me your understanding of what you've picked up from the information that we've given you? And pause and listen and respond. So in that situation, I don't know if you can kind of tell the difference, but we are asking the person to tell us what they've understood, rather than kind of saying yes, no answers. And that way, because they're telling you, you will then know what they've actually absorbed about what we're asking them to do. And it could be that they've given you a really good overview, but they've just missed out a couple of key points that you want to just check, and you can use the same method to check their understanding. So say they've given you a brilliant overview, they've not mentioned anything about follow-up, and you really want to make sure that they are happy with that. So, oh, that's brilliant, you've obviously got a really good understanding of what we're asking you to do. Did you notice anything in there about follow-up arrangements? Could you explain to me what we are asking you about that? And again, pause and see what they say. So that's the method I use. I hope that is of some use, and try it and see what you think. You could end up with, well, in my experience, probably one of three scenarios. So you get someone who gives you a really good overview of the study, they've clearly understood what you're asking them to do, they're happy to go ahead, fantastic. You might end up with someone who's kind of given you some vague words to do with the study. You kind of get that they are interested, they got a bit of an understanding, but you're not quite happy they've got enough of an understanding to go ahead. That's fine. Obviously they might just need a bit more time, and that's fine as well. So you can just consider what you might need to do in that situation. Maybe go give them an overview again and come back and just check their understanding and what their thoughts are. Or you could end up in a situation where someone clearly has absolutely no understanding at all. And if that happens, just think about, why have you got someone in front of you who is saying, yes, I want to go ahead with the study, and yet they have absolutely no understanding of what we're asking them to do. So in my experience, it tends to be one of three things. So firstly, and most commonly, they just want to make you happy and please the doctor. and they almost need permission to say that actually, don't worry, that's okay, it's your decision. And if you know, no one's going to be cross, no one's going to be angry if you decide not to take part. And it could be that they actually can't read the information sheet, so it may be that they've not got reading glasses with them and they just didn't want to say anything. It could be that they're not able to actually read, and so you might want to just go through the information sheet, read it for them, and go through it, spend a little bit more time with them if they are keen to consider the study further. Or it could be that they're temporarily lacking in capacity at that given moment in time, and that might catch you off guard a little bit, because it might be someone that you've maybe met before, it might be someone that you've looked at the notes and it's clear that they usually would have capacity to consent, but in this particular situation it may be that they're lacking capacity due to anxiety, or something else that's going on in their lives. So just be aware of that. That can happen, and that has happened to me before, and in those situations they may almost just need you to say, you know what, I think you've got a bit much on your mind at the moment, should we just leave this? And that's okay. And more often than not, when I've done that, I've had people say to me, oh yeah, thank you, and actually it's a relief to them to know that they don't actually have to worry about this at the moment. They've got other things on their minds, and that's absolutely fine. So I hope that's helpful. Obviously don't forget to document everything, document your conversation, document any questions that the person may have had and your answers to them, and yeah, I hope that's of use. Thank you.